It's good to see you, Martha. I'm multitasking here, taking my lunch while we're doing it. Hopefully Daniel's good, I hope.
Yes, thank you. Everybody's well on my end, thankfully. Just hanging out. It's 12:02. I'm going to give it one more minute and then we'll get started. Again, everybody, thank you for joining us. I'm so glad to see everybody. It's great to see you. We miss getting together in person, but this is the next best thing. So it's nice to see everybody's smiling faces. I hope everybody's doing well. So today we have the privilege and the honor to hear from our TMA president, and I'm so excited. It's my privilege to introduce her today. Dr. Diana Fite is the 155th president of the TMA. Dr. Fite is truly an amazing lady, and I'm so glad that we all get to know her today. She was raised in Amarillo, Texas, and she attended West Texas State University in Canyon for her Bachelor of Science degree. From there, she went on to receive her medical degree at UT Medical School in Houston. She's been a member of the Harris County Medical Society for 4 decades, fighting for the rights of physicians and patient care. She's a mother of 8 children and has more than a dozen grandchildren. People consider her a gentle giant. She is a very lovely person to get to know and will make you feel right at home. But she's a fierce warrior for the family of medicine. During her installation speech, she said, "I might not always have a say in what happens to me, but I always have a choice about how I respond to it." I believe she has lived up to this throughout her life. So without further ado, I introduce Dr. Diana Fite. Thank you for being with us.
Thank you very much, Martha. It's a privilege to be asked to start these talks, and I hope this one is good enough to meet your expectations. I know it talks about inspirational. I'm not sure that I'm inspirational at all, but I have had a lot of things that have been good to happen, a lot of things that have been bad, unfortunately, but it all works out in the end and is for the best. There's no question about it. I wanted to start real briefly about my history. Next slide, please. Jennifer's going to be progressing the slides here. My father was born in England, and he went to medical school starting at about age 17 there. He went through everything very, very rapidly, and they were allowed to do that in England. You could progress like that back in the early years. And he actually immigrated to the United States in about 1950 because there were no neurosurgeons in the panhandle of Texas, and they were trying to get a neurosurgeon there. Actually, he went 1 year to Cornell to teach and 1 year to Vanderbilt to teach, and then came on to the panhandle of Texas. Next slide, please. And my mother was a nurse. She grew up in Virginia and was the 1 out of 4 that was brave enough to leave Virginia and go on to Chicago to nursing school, which was considered very drastic in that family who were raised on a farm in the Depression. And she then somehow ended up in the panhandle of Texas as well and was an operating room nurse, and apparently the only one that could stand my father, the neurosurgeon, or at least could understand what he needed with all his demands, apparently. So that's how they had met. And next slide, please. And even though he wasn't a naturalized citizen until I was about 13 years old, somehow he served in the Navy. We lived in Oceanside when I was a little girl, and that was just a picture there. I guess when you were from England, you could still serve in our military, even if you weren't an actual citizen. So, and as a physician, they definitely wanted him there. Next slide, please. And so I was a happy baby, yay. The first, one of 2 born to my mother and father. And next slide, please. That was just another picture. Next slide. So I'll talk just a second about this as the family from England. But when I was about 5 and 6 and 7 years old, and my father, again, was the only neurosurgeon for many years up in the panhandle of Texas, and that included part of Oklahoma, a little part of Kansas, a little part of New Mexico. It was a large, large area. And of course, back then, the cars were not made safely like they are these days, and they were just steel that crushed whenever someone had an accident. Lots of people on horseback back then. So lots of brain injuries. My father was in very big demand back then. And what would happen is that in the middle of the night or whenever a bad accident had happened, then he always had a white Cadillac. So he would go to the edge of town. DPS officers would meet him at the edge of town and escort him going 100 plus miles per hour. And then, of course, on their radios, they'd be able to say if the patient had died and he wasn't needed after all, they could stop him and turn him around and go back to town, because all these things were during the middle of the night, and he had to still work and see patients and do surgeries during the daytime. So anytime he didn't have to be doing surgery during the middle of the night was good. And he would put a big old bag of super sour lemon drops by his seat in the car so he could just suck on those really sour lemon drops and stay awake. And he would always take me with him. And my mother was just aghast. She was not happy about that at all, because she was worried about how fast we would go. And but it was a lot of fun for me. I thought it was a time to spend with my father, and I guess that's why he did it. My brother wasn't born until 4 years later, so it was just a way to that he thought to spend time with me. And we would get to the hospital, and the nurses' stations always were set up to where they would have a little place for me to sit and color and read books and things like that. And then he would take me to make rounds with him on weekend mornings. And then especially if he had patients who were children, he would let me just stay and talk to the patients and make friends and kind of entertain them. And that was a lot of fun. I made a lot of friends that way. And it was back in a day when you could do things like that, of course, without HIPAA regulations or things like that. Everyone seemed to not mind someone like me being there. I'm sure it was irritating to some people, but they never made me feel that way. And I got a real love for, I think, medicine in that way. And I thought my father was the smartest man in the world. I actually still do think he was very, very smart. Of course, remember back then you didn't have CAT scans or things. He would be able to just examine a patient and know right where he needed to make a burr hole or open the skull up. He would base that on their reflexes, their pupil dilatation, or things like that. He did not have any sort of imaging to do to tell him like they do nowadays. So I felt like he was just brilliant. But he never talked to me about being a physician. This was all about actually kind of helping him out with his younger patients, and who knows, and again, spending time with him. He certainly did not expect me to ever be a doctor. There were hardly any female doctors at all back then. We're talking the 1950s. And my mother, again, was just upset that he was taking me after all. And she definitely did not want me to do anything like that. It just wasn't discussed. It wasn't thought that that would be a way of my life. Even going to college and things like that wasn't discussed. So I thought that was kind of interesting. Now, later on, when my brother was born, my father didn't take him with him like he had done with me. But of course, the conversation was always with my brother that he would be surely a doctor someday and go on to medical school, and which he did, by the way. He became a neurologist. So I just thought that was interesting. When we had in about the 4th grade, a little thing that the families came to the schools and saw us. There was one of those questions about what do you want to be when you grow up? And we were all supposed to go in front of the parents and say what we had wanted to be. And most everyone wanted to be a fireman or a police chief or things like that. But all I wanted to be when I grew up was a mother. I went and said, I want to be a mother. And my mother was so proud of me. She thought that was just wonderful. And she kept the little program that showed what everybody wanted to be when they grew up. She has that to this day. And that's all I wanted to do. I hadn't thought of anything else. Somehow, the Beatles and everything became so popular. England became very, very popular when I was a young teenager. The Beatles appeared when I was about 10 years old. And so since my father was from England and I had a large part of my family there, we got to go back and forth to England. And that made me very cool with the kids. This is a picture of my grandparents in England. And then I had, in addition to my father, was his brother, who married a Thai lady. And that's why you see the 4 children there, my cousins who look a little different from me and my brother there on the edge of the sofa, because their mother, my Auntie Simorn, was Thai. And then the 2 children in the laps of my grandparents, my Auntie Pauline had married a Scottish royal military officer. And she was a nurse, by the way. And so I had 2 half Scottish cousins, and then there's myself and my brother. So I just always loved that picture from England. It just looked like quite a mixture of people there. But the cool thing was going back and forth to England, and that I was actually a British citizen. If your father was born or from England, back then you could automatically be a British citizen. I had a British passport, of course, in addition to American, obviously. And a few years ago, maybe 2 decades ago, they changed it to where if your mother was born in England, you could also become a British citizen. But of interest, it was just the father for many, many years until that was finally changed. Of course, my mother was from Virginia, so it didn't matter there for me. Next slide, please. So then somehow, as the years went by, once I became 16, I really got sick and tired of living at home. And this is when, if anyone on here is my age, remembers there's so much rebellion and everything going on. And I was always, straight A student, but had no desire to do anything special. Like I mentioned earlier, not even go to college or anything. It's still the parents never talked about any expectations of that type of thing. And so I just decided by 16 that I wanted to live by myself, but I didn't want to be by myself. I wanted to be married. So my boyfriend, who had just turned 17, and I decided that we would get married. Of course, my parents were not happy about that at all, nor were his parents. But I just said, would you rather I run off to California or something like that, or let me get married? And they just finally said, okay, I guess so. So they didn't allow us to have any friends or anything, though we did get married in front of a preacher. And that was my wedding dress and my wedding cake at our home. And we got married. And it was a lot of fun. The high school where I was going would not let 2 married people attend together. So I did have to transfer over to his high school. They would not let the married person be a valedictorian or salutatorian, which I was supposed to be one or the other, kind of competing with one other person. And but that didn't bother me because I was afraid to give speeches and all back then anyway. So I didn't even want to. So we transferred to his high school, Tascosa High School, which allowed us to be married and go together. And it was fun because if he was sick, I was his official guardian, and I would call in for him and excuse him from school that day. If I was sick, he would call in and excuse me from school. And though that rarely happened, we were both good students. And that was how we finished up high school, starting at the beginning of our senior year. And I had so many credits, I only needed to take 3 required classes. So, and he also did as well. So we would go to high school all morning, and then we both had full-time jobs starting in the afternoon into the evening. And I was a waitress at Howard Johnson's in the beginning. And at 16 and 17 years old, became the head waitress within just weeks of being there. And our cook was 15 years old, but looked a lot older. We didn't have the same type of child labor laws back then. And so we ran Howard Johnson's in the morning, a 15-year-old cook and a 16 or 17-year-old head waitress. And that was interesting, but just seemed like the thing to do to me. It didn't seem as odd, and I'm sure looked very odd back then. And my poor mother would come in and get a cup of coffee and just cry the whole time and leave me a great big tip. And it was really sad to think about it, but I thought it was just all fun, and kept making all A's in school, so that was good. So when we finished high school, I thought, well, maybe I should do something. I thought, well, how about a legal secretary? That sounded like kind of a big deal to be a legal secretary. So I signed up for courses like shorthand and English and things that were required for the beginning of school. And by then I'd gotten a job in a business office of a hospital where we did file. I was a file clerk initially, and then later on into insurance billing and collections and things like that. And so I would go to college from 8 to 10 in the morning, take 2 classes, go to work from 10:30 to 6:30 every day, and then go back to night school from 7 to 10 at night, and found that those shorthand classes and things like that were pretty easy. So able to keep up all A's, and just started going through like that, thinking, well, a legal secretary would be a good thing to do, would be a good job for the future. And then, and one of the people at work, her husband was pre-med at West Texas State. By the way, I started out at Amarillo Junior College, and after I finished there, I went to West Texas State. So she was always bragging. She was a little ahead of me as an insurance clerk from when I started at the hospital business office, and always bragging about how her husband was going to be a doctor. He's pre-med, he's pre-med, he's pre-med. All we heard about was how he was pre-med. And I met him, and we started to do some things together. And I realized he was no dummy. He was fine, but he didn't seem that smart. He wasn't like my father was. I thought, how can he be a doctor? He wasn't compassionate about people. He would make fun of people. He just wasn't what my opinion of being a doctor was. And I thought, my goodness, if he can be a doctor, which I thought pre-med just meant that you would become a doctor. If he could become a doctor, then maybe I should become a doctor. But again, women were generally not doctors back then anyway, and I certainly hadn't had any encouragement. So I thought, okay, maybe that's what I'll do. By the way, he turned out to be a dentist. He never got accepted to medical school, but he was still a smart person. So apparently did a good job as a dentist staying in Amarillo. And so I went home and I told my parents that I think I might as well become a doctor. That sounds like just somehow it set well with me. And my parents said, no, there's no way. My father said, you cannot be a doctor. You're not smart enough to be a doctor. Women just shouldn't be doctors. My mother, the nurse, was the same way. Women, really shouldn't be doctors. That doesn't make sense. Of course, I was already married, so they couldn't say you need to get married, but hadn't had any children yet, so it wasn't trying to. So that was in the future, though, of course, since I always wanted to be a mother. And so I thought, well, I gave it some more extra thought, since my parents didn't want me to be, and but somehow that just set right with me. That's what I wanted to do. And so luckily then got accepted into medical school. And of course, I still had to go through all my classes, keep up the straight A's, things like that. And even at the very end, when it got to too many chemistry classes and things that had to be done in the afternoon for laboratories and all, I finally had to quit doing my type of working for 8 hours during the middle of each day. And I had to change to part-time jobs, but the college had jobs for me and teaching assistants and things like that. So I was able to get through just fine, and thankfully got accepted to medical school. And my husband decided to be a PhD in psychology, and So we applied to Southwestern Medical School and they accepted me, but the PhD program for psychology only had like 2 or 3 candidates they would accept. He didn't get accepted there, but he got accepted at U of H psychology program. So I quickly applied to medical school at University of Texas. They had just started a brand new medical school, which I was a little reluctant to go a brand new one. I thought Southwestern's so well known and has such a great reputation. University of Texas at Houston had no reputation yet at all. But I wanted to go where my husband had been accepted, of course, for his PhD at U of H. And so I made a phone call. They said, well, you have to give up your spot and then see if anything opens up in Houston. I thought, well, I can't give up a spot. What if nothing opens up? But they said, well, let us make a couple of phone calls. And it wasn't an hour later, someone had agreed they wanted to make a trade. So I quickly got to University of Texas at Houston, which turned out to be a 3-year school instead of a 4-year school back then, because they didn't take off any time for summer vacation, anything like that. So it worked out very well because I got through extra fast that way. And so eventually my husband, Pat Fite, and I just sort of went different ways. Medical school took just too much time. Somehow, even though he was in a PhD program, he didn't like hearing all these medical stories. He would look like he was turning green when I told him stories about medicine. And he just said, just don't even talk about these stories about operating room and bodies and the things I would see in the emergency room and things like that. He hated hearing about it. And that seemed to be the beginning of the end. So after 7 years of marriage, we had divorced. And then I decided to go into Ob Gyn for my residency program. Even though I loved every time I was able to go to the emergency department in medical school, because we had a lot of leeway back then for various reasons, but especially from being a new medical school. And I was just talking to Elsie Whitmire about that's when Life Flight started when I was a medical student. So they let us ride on that all the time. And all that was just great fun. But emergency medicine was just a brand new specialty. And my father had actually contacted me and said, you know, Diana, I've heard of this new specialty that somehow I have this feeling would be perfect for you. And it's called emergency medicine. But they only had like 2 residencies in all of Texas for emergency medicine back then, one in Detroit, Michigan, and one somewhere on the East Coast. It was such a new specialty and certainly nothing at University of Texas at Houston. So I loved Ob Gyn too. I loved helping women. I loved helping deliver babies, things like that. So I accepted a residency program there in Ob Gyn and started that. But in Ob Gyn, we had this 27-year-old female who was 27 weeks gestation, easy to remember. She was having a lot of pain, trouble breathing. She looked very bad. I was just a first-year resident at that point, went to my chief resident and said, I was really worried. I think we need to consult some other specialists and see what's wrong with her. And he said, no, OB-GYNs don't do that. We'll take care of her. Well, he did an EKG on her and he said, you know, just look at all the little blips up and down look the same. So I think that means everything's okay. We really didn't have much other training in OB-GYN on other things. And just remembering from medical school, I said, oh, okay, well, next morning I come back and she's died through the night. And of course, now in retrospect, looking after it, she probably threw a pulmonary embolus or something like that. But we had no clue. This just didn't seem right to me. And so I started having more interest in having some specialty that took over more things. Now again, this was years ago. This was over 40 years ago. And now OB-GYN is a lot more diverse. Most all the specialties know a lot more about other things. Back then, it was a little more condensed to just that specialty. And so I start spending every single shift or every single rotation that I could that was an elective in the emergency department, and began to love emergency medicine. And again, there weren't any residencies in Texas, any residencies in the south part of the United States. There were a few more developing on the east and west coast and up north. But we were giving the ability back then that if we decided to do something that was a brand new specialty, as long as we took 5 years of full-time practice and then passed our oral boards and passed our written boards, we could become board certified in that specialty until enough residencies had developed that they would require residency training and then to get your board certification. So I was old enough that that worked out. By the time I finally decided this is for me, emergency medicine is what I want, it just feels right for me, then I quit the Ob Gyn training. But the main thing that made me quit that was I had had my first baby at that point. I had Tracy. Oh, go to the next slide, please. This was my husband and I in the second year at college. Next slide, please. And this was graduation from medical school. You see how small our class was because we were a new school. It was only 67 people in the class. 14 were females. They were thought to be very advanced by taking so many female medical students. Next slide, please. There's me, shortest one, of course. Next slide, please. And this was my next husband, last husband, next husband. And we got married during residency. Next slide, please. And this was my first baby, Tracy, born during residency. At that time in the Ob Gyn residency, I was the only female in that program. There had been one before me and then another one joined later on, but there were only 4 slots per year in residency in Ob Gyn. And so it was quite an experience there because I didn't realize how much pain it was to have a baby. We just were sort of taught by, you know, the resident above you teaches you, and that's how it kind of was back then. And we just didn't realize how much pain having a baby was. We just go, these women just they complain too much when they're in labor. And till I went into labor and decided, oh my gosh, this is horrible. And so then I was able to at least teach our fellow all male residents that they need to be nicer to these women when they're in pain, and they need to give epidurals if they need them and things like that. But that was my first baby there. So the Ob Gyn residency, since we were such a new school and all, we didn't have enough patients to give us as diverse things that our program director wanted us to experience. So he set up a deal at Breckenridge in Austin where all the residents would go and spend 2 months straight each out of their year in the second and third year in Breckenridge in Austin. Well, many of the guys were single still back then. They were thrilled. Breckenridge was known in Austin to have so many cute female nurses and so many nurses and things like that. They were all thought this was great fun. They'd get to do a lot more cases and at the same time have a lot of women to meet or date or end up marrying, things like that. And but I was horrified. I had a new baby at home. My husband heard this and he was just, there is no way. We didn't have that much money and wouldn't be able to afford a nanny full time, or didn't think we could, that type of thing. He just put his foot down and said, you can't do that. And I didn't want to do that. I didn't want to leave a baby for 2 months as it was. I hardly ever got to see her because we didn't have special hours for residency back then. And we worked very, very long hours and were in the hospital every third night. I mean, I didn't get to see her much at all. I had to pump all the milk. I couldn't breastfeed her because I never saw her. And so anyway, I told my program director that I did not want to go to Breckenridge. He said, well, if I make an exception to you, even though you're the only female, but if I make an exception to you, then it'll look like I need to make exceptions to everybody, and that I'm playing favorites and I can't do that. So I said, okay. I knew my husband wasn't going to let me anyway. And so I looked more and more into my ability at that point to practice full-time emergency medicine, start to get my 5 years in and be able to take the boards and become board certified in emergency medicine. And so as soon as I made an agreement to go with another person who was an internist who was doing the same thing, and we were going to run an emergency department at Sam Houston Hospital in Houston, and told my program director, he said, well, all you had to do was tell me that you really, really meant it, that you didn't want to, that you were going to leave, and I would have let you out of that. I was going, oh, great. Well, now I've signed contracts. I've made my agreement. Emergency medicine is what I'm doing. And I left. And again, it was a wonderful decision. If I had not done so, I wouldn't have been able to make a name in emergency medicine as I was able to do, which was great luck for me. Next slide, please. So that's just a picture of me in the emergency department with two of my good friends. Next slide, please. And another one of my husband and myself at a Christmas party. For those who might be on the call who possibly are my age, my husband, Ron Patton, was active in the Alliance for a few years, became president of the smaller counties that we lived in. I've always been a member of Harris County Medical Society, but we actually lived in Waller. So you're allowed to be a member of the contiguous medical society, but he was president of Grimes, Austin, Waller County, whatever it was, and did a lot of things with the Alliance, including going to several meetings in Chicago. Next slide, please. Then he decided not to anymore. And then we started to have children, which was wonderful. And by the way, I had that first one in residency because I was doing all these rotations through reproductive endocrinology, and my teacher or professor there kept telling me, you know, Diana, what are we seeing here in reproductive endocrinology? We're seeing all these women in their 30s who want to have children and aren't able to. They've developed infertility or for whatever reason. He said, don't wait so long. So when I was 26, I decided to go ahead and start. And plus I said, well, I've got to finish residency first. I need time to take care of a baby. He said, you are not thinking straight. When you get out into practice is when you're going to be really busy. Residency is easy. You've got people to help you out. You've got your attendings to correct mistakes, to teach you. This is the time to start having babies. Don't wait until you're in practice and you're too busy. So that all made sense to me. So that's why I started during residency. But then I just loved my first baby so much that we decided to have several more. And after the third child, you see the top row there was Tracy and Anna and Arthur. And then the next two, I hadn't gotten pregnant as quickly as I had with the others. And I actually, in addition to emergency medicine, I was doing some part-time gynecology. I still loved Ob Gyn practice and working with an adoption agency. And they came to me and said that we had this baby that was born at 31 weeks gestation, so 9 weeks early, and we're having trouble adopting her out. Do you know of anyone who might be interested in having a premature baby who would be able to afford it because the bills are going to be very, very high? And this adoption agency was one that they expected the adoptive parents to pay the hospital bills. They didn't include it like many do nowadays. So I just felt like God was telling me something here. And I said, well, you know, we haven't had our next baby yet. I think I'll go ahead and do it. I talked to TMAIT, our TMA insurance. And actually, if you adopt a child, they'll pay for the hospital expenses, or they did back then. And so I went ahead and adopted Elizabeth. And then another adoption agency came to me a year or two later. I still hadn't gotten pregnant with another baby yet. And they said, we have this mother who reminded us of you. She looks almost exactly like you. She's had very unfortunate circumstances, a bad car wreck. She was in a coma for a while. She was put in an assisted living facility because she had been an adopted child whose parents were elderly. They were since then dead. She had dyslexia. She woke up from her coma deaf from the antibiotics. She was just in horrible shape and had found herself pregnant from the delivery guy. And so she wasn't able to handle a baby. And since she looked so much like me, they wanted to know if I had any interest. So I met with her. She wanted to make sure that whoever adopted her baby had multiple other children, because she didn't want that baby to end up being a single child like she had ended up being with older parents. And so we told her that I was a pediatrician from Dallas. We didn't tell her the actual truth, which was okay. That had not been demanded. And she just wanted to know about me. And so she was so happy that we had other children. And so I got Alexandria, who had nice bright red hair, just like my mother has, and got her when she was 3 days old. And that worked out just perfectly. Next slide, please. And then I had 3 more natural children, and Renee and Aaron, the second little boy, and then the baby down at the bottom of the picture, Amanda. And that completed our family of 8, which we were real happy about. And again, God just put his hand in there. He was just, you've had the 3, you can adopt these 2 if that's what your heart tells you to do, which it definitely was. And then gave us 3 more natural children. So that just worked out very, very well. Next slide, please. And here they are, much older. They were so nice to give me that wonderful picture, which was very important, because then I ended up losing 2 of them after that. So we had many issues during all this seemingly wonderful life. I was always working 2 full-time jobs to make sure that I could make enough money, and I wanted to do full-time emergency medicine. Plus, I did do the outpatient gynecology for many years as well. But I always knew that it was important to be involved in organized medicine. When I went to my first meeting with Harris County Medical Society, which was an orientation meeting, and there were lots of physicians there, and they told us about how important organized medicine was. And I was just 1 year out of into practice. And I looked around at the leadership, and they all to me looked like old men with white hair. That's just what they looked like. And I understood what they were telling us about how important it was politically to be involved. And it just seemed so interesting and so important that I went up to some of the leadership people, and I said, I just don't see many females here, and everybody is a lot older. Don't you think it would be good to have someone younger and with a different perspective to be on this or that committee, or I'd be happy to help out with this or that. So before I knew it, everybody was very, very nice to me and put me on committees. And I'm sure they were the least desirable ones in the beginning, but that's how everybody starts. And as long as you're willing to do the work, you can advance. And I did very well with both Harris County Medical Society, being able to do a lot of activities, make videos, all sorts of things that were helpful, and be able to especially pay attention to helping some of the younger physicians too, because we were just getting started with inviting young physicians in and having spots for residents and medical students and all that. And then the same thing with our Texas College of Emergency Physicians. In 1996, I became the first female to be the president of the Texas College of Emergency Physicians. So I was very excited about that opportunity. And we had in 1997, well, actually right before then, we had some problems with the IRS. So we had a huge IRS debt. They didn't teach you things in medical school about finances. My parents have certainly not taught me anything about finances. And I just didn't understand about the importance of when you're an independent contractor. And I had a full-time outpatient gynecology practice that was just independent. And then I had emergency medicine, which we worked as independent contractors. And I wasn't setting enough money aside to pay the IRS. I wasn't understanding things. So we'd have to scramble up at the end. And then we had purchased a building for the office practice and ended up selling it and made a profit on it, and ended up that we had to owe a large amount of taxes on that. Well, I was never able to have enough money to pay the taxes when they were due, had to scramble and postpone and take some penalties and things like that then. But when we suddenly found out we owed about $350,000 on the sale of this building, and we did not have that, though we sold it, we owed money to the people who had advanced the money to purchase it in the first place. So we didn't have any money from the sale of it at all. We just owed a huge amount in taxes. So we didn't make enough money to pay that for a year after year, and eventually penalty and interest accrued, and we were starting to get behind on the other. And before you know it, it was up to a huge amount of money. It was up to like $1.5 million that we owed. And I know y'all think that is so irresponsible and unreasonable. We just didn't have the right financial counseling. Just any way you look at it, it was my fault. It was totally my fault and my husband's fault. He didn't want to face it. It was a major problem with him. And eventually, of course, we finally worked out agreements, and I did pay back every bit of it. So it was all a done deal. But boy, I had to work like mad. I was already working 2 full-time jobs anyway, and there was just no time. So I would work all night so I could see the children during the day. Otherwise, I was working 7 nights a week, and then sometimes a whole day on top of it. So I really had to force myself to be able to make time to spend with all those children. And I didn't want to be an absentee parent by any means. And so that was a big problem. But then that was completely overridden by, in 1997, my son, Aaron, who was my second, and I only had 2 sons and 6 daughters. He was diagnosed with leukemia, and he did well at first with treatment, though he had gotten so sick by the time he was diagnosed. And by the way, diagnosed by the wife of Dr. Arlo Welke, who a lot of y'all know is our current Speaker of the House. He and I went to medical school together. We were medical school classmates. Our birthdays are like 4 days apart. So we were good friends. And then he married his wife, Janet McAulette, who became an oncologist. And she diagnosed his cancer, but she was not a pediatric oncologist. And he had just turned 7 years old on the day that he was diagnosed. So she arranged for us to get the help through MD Anderson. And over time, he relapsed several times. So that was not good, but eventually went into remission from that cancer, but later on developed secondary cancer from all the radiation and chemotherapy and problems that went along with the first cancer. So that just paled. The IRS, of course, I had to pay strong attention to them. They can just devastate your life if you owe them money by taking your house, taking your bank accounts, taking everything if they decide to, if you don't cooperate. And but that was nothing. I would have suffered for them for the rest of my life, anything not to have had my son have that horrible cancer. So then I went 6 months where I couldn't even talk about it to anybody without just bursting in tears. It was so painful. And my husband had to spend all the time with him because I had to work like mad. I could make so much more money than my husband. And we had to, and then try to not ignore the rest of the children at the same time. At one point, he had to have a stem cell transplant, and my husband had to be essentially locked into the room with him for 45 straight days. Happened to be over Thanksgiving and Christmas, where they couldn't leave the room. We couldn't go in the room because he had a stem cell transplant, and back then they could get infected so easily. And so all sorts of issues we went through there. That was not an easy time. But then it still needed to stay active with organized medicine. I still felt a compulsion to be sure that we were standing up for ourselves, and especially for emergency medicine, especially for women in all these areas. And so I made sure that in these daytimes that I had off, even though I needed to sleep a lot of that, I made sure that I attended meetings, that I stayed active in things. And eventually became president of the Harris County Medical Society in 2006, which was a wonderful honor. I was the fourth female to be president of Harris County Medical Society. Well, then I was really working it hard because I was trying to attend a lot of the meetings. I gave a lot of talks, things like that. I had made a promise to try to get 4 hours of sleep per day. Again, working all the nights, 4 hours of sleep per day to keep healthy. And what happened was that I couldn't have 4 hours of sleep. I was lucky to get 2 hours of sleep per 24 hours. And that may have contributed to what happened to me in June of that year as president of Harris County Medical Society, as I had a major stroke. I was driving home from work, from the emergency department, and suddenly my right side was completely paralyzed. I was so lucky able to get off the road into a parking lot because, of course, my car started swerving since suddenly my right side was completely paralyzed. I was able to call for help, even though I couldn't speak at first because my voice was affected by the stroke, but managed to get out to the dispatcher, the name of the street where I was. And I was the medical director of the emergency medicine or the EMS system that came to get me. So they, once they figured out who I was and they recognized the vehicle, they were able to quickly get me to Herman Hospital, where I was on faculty as part-time clinical assistant professor there. So Dr. Grata, who is the father of TPA or grandfather of TPA, the clot busting medicine for strokes, was there within an hour of having this major stroke that had left me 100% paralyzed on my dominant right side. I got TPA. It worked, probably because I got it so fast. And within 20 to 30 minutes, I was starting to be able to move that side, though it was jerking, painful movements at first. Within a couple of days, I was fully recovered from this massive stroke thanks to the TPA. And what a blessing God gave me there. That it scared me, but as soon as I realized I didn't have a bad headache, so I didn't have a hemorrhagic stroke, it was an ischemic stroke that I knew could be broken up by TPA. TPA had only been out for a couple of years for that purpose. And I just had the biggest calm over me that everything is going to be okay. God told me that. And it was, but that was such a major thing. And it gave me the opportunity to write many editorials, be on TV. I was on national TV. I also did a lot of interviews with Morgan Fairchild, the actress, who was a spokesperson for the American Neurological Society. And I was a spokesperson, though unpaid, for the American College of Emergency Physicians about strokes. And we had opportunity to educate lots of people about avoiding high blood pressure, which was the main cause, but they also thought the fact that I was not getting enough rest and all those bad health issues that I was causing myself contributed to having that stroke. So now I make sure I get at least 4 hours of sleep, if not more. Nowadays, more than that, between having to work. So then I was continuing to be active in everything with the Texas Medical Association, with our American College of Emergency Physicians. Then the most tragic thing happened is back in 2014, my second daughter, Anna, who did have a seizure disorder, but it was controlled with medication. She had a bad seizure and her heart stopped and she did not wake up from that seizure. She died. She was 33 years old. Sorry, I can hardly talk about that still. Left a 1-year-old baby who had just stopped breastfeeding that month, and she died. And so that was just heartbreaking. But again, she had the strongest belief in Jesus and God. And she had always felt like with her seizure disorder that something was going to happen to her at a young age. And she would always tell me, Mom, if anything ever happens, don't be upset. I'll be in heaven. I'll be with Jesus. That's the most important thing. So I try to always remember that actually worked out for her. And so, of course, things have to go on. No question about that. So then back in a few years later, Aaron had a relapse, or he developed a new cancer called epithelioid angiosarcoma, which is a sarcoma of the lining of the blood vessels. So it was everywhere. It was in his bones, his liver. It was a nasty metastatic cancer that he got. And though MD Anderson was able to put him into remission for a while, it could not last. And he finally died just this last June, on June the 11th. So those were two major heartbreaks, is why I say some bad things have happened through the years, but they're in heaven. They're where they need to be. And my faith in God is so strong. I'm one of those people that prays all the time. I think I've done that since I was a little girl. I've multiple times per day, I'll pray for things. I'll pray and thank God for the silliest things, because I know that he doesn't mind what you pray for, but also for these important things, that things work out the way that he intends. It's God's will. And he has definitely guided me through all these years of ending up as a doctor, ending up being my purpose in life, to be an emergency physician and to be in all these positions to help as best I can in taking care of things. And of course, then one of the wonderful things that happened to me, being the sixth female president, and the 155th president of the Texas Medical Association. And just to me, the highest honor that I could not have dreamed was possible in those early days. In the early days, I thought, wow, wouldn't it be fascinating and wonderful to be president of the Harris County Medical Society, never thinking that it could be the whole Texas Medical Association. But that certainly has been something that I've been very, very happy to be able to do. And I've been asked to just share a little bit of my goals as president, which have been totally ruined by the COVID pandemic. When I was president-elect, I was so excited because Texas was making a lot of money on oil industry and taxes, things that were coming into the Texas government. And I thought, this will be the first year out of 20 years physicians have not had any increased payment from Medicaid. And all the rural physicians, who so many of their patients are on Medicaid, or people on the border in the poorer parts of the cities. There are so many physicians who depend on Medicaid for taking care of the majority of their patients, and so many physicians who aren't able to take Medicaid at all because they just can't keep their practice going if they took such low payments for taking care of sometimes the sickest of patients. So I was excited as president-elect that once I became president and the legislative session started, we'd be able to finally get an increase in Medicaid payments for physicians. And then the pandemic hit. Of course, our taxes to our state government began to shrink rapidly, and they began to plummet, especially because of the loss of jobs, especially because of the oil industry falling apart, people unable to travel, use gas. Just the various reasons. All of a sudden, we're at a budget deficit instead of the nearly $3 billion surplus we thought we would have. We are now at a $1 billion deficit. We thought it was going to be more like $3 billion, but luckily the comptroller Hager has released his new numbers and says he thinks it's more like 1 billion. And we do at least think we'll be able to make that up in the legislature, so they can make their every 2-year goal of a balanced budget. But that's not going to put money into the pockets of physicians in any way. We're going to have to fight like mad to keep them from dropping some of the things we have accomplished for Medicaid and graduate medical education and things like that. But I had set up my priorities as president, which the TMA staff has been so nice to try to help out with those priorities as well, while their attention is so much on COVID and getting us PPE and getting the physicians' practices going, and telemedicine, and all the efforts being put into the COVID pandemic. on top of the legislative session now opening, so that we have to focus on the legislative priorities to help physicians and our patients. But the things that I had set forth as my goals, one was prudent layperson. If a patient thinks that as a prudent layperson, they have an emergency and they go to the emergency department, then the insurance is supposed to cover that. That is a law, it's federal law and state law. And once the insurance companies, starting with Blue Cross in particular, found out or figured out that there was no financial penalty if they didn't obey that, they just quit following it. Now, many patients come to the emergency department if the diagnosis doesn't turn out to be life-threatening, if their child's 103 temperature turns out to be an ear infection, and they said, well, you could have gone the next day to get that taken care of. We are not going to cover any of these costs. And the multiple things that turn out, they've just quit paying for them. And so that's a horrible loss of income to the emergency departments, who see so many patients, especially in Texas, with the largest number of uninsured patients and uninsured children in the nation. We do so much charity and no pay care. You have to have something from the insurance companies. And again, the Medicaid not even paying for what it costs to take care of those patients. So once the insurance companies stop obeying prudent layperson definition of emergency, then that's very hurtful. And then another of my goals was to call out the insurance companies more vocally, because they know exactly what they're doing. They don't cover what they tell patients they're going to cover. Our premiums go higher and higher. The copays, the deductibles are horrible. And yet the insurance companies don't cover so many things. Prior authorization is required, takes up tons of physician time. Many of the physicians in Texas pay a full-time person to do nothing but prior authorizations in their offices. It's so costly, so ridiculous. Most everything does finally get approved by prior authorization. Then they've got a new trick. They'll approve something as being allowable by the insurance, but once the procedure is done or the test is done, the insurance company comes back and says, well, yeah, we authorize that, we cover that, but now that we've seen your medical records, we've decided we're not going to in your case. So suddenly the physicians don't get paid, or the patients have to pay a huge amount, and that's unexpected. Then also another thing, they'll have $12,000 deductibles or $6,000 deductibles, and they'll have met that deductible. The patient tries hard. That's a horrible expense to them. And then the insurance, they think, is going to pay from then on, maybe the 80% or whatever their setup is. And then the insurance comes back and says, oh no, you may have paid $12,000, but we only think they should have charged you $1,400. So we're going to give you credit for having paid $1,400 of your deductible. You still owe another huge amount to meet your deductible. So those kind of shenanigans are going on like mad, while the insurance companies are making billions of dollars in profit. But the problem is, and this is where the Alliance can help us out, I truly feel, the insurance companies make huge donations to Congress people. It's not so much a problem in Texas, because our Texas laws only cover about 20% of insurances. 80% or so are under federal law because of ERISA rules. And that 80% is where the insurance companies want to make their tons of money. So they give these huge donations to Congress people. All they have to do is donate to the majority of the Congress people, especially who are on the key committees that have to do with their issues. And all of a sudden, the votes go in favor of the insurance companies for any of these problems that we try to bring up with legislation, and not to the benefit of patients or physicians. Now, if enough patients would go to their legislators, if they had enough of a cry from their constituents to stop this abuse by the insurance companies, then the legislators would finally start to listen, because they don't want to lose their elections. But they don't care about the physicians complaining about it. It's they still get way too much money as donations from the insurance companies. So to me, this is one way we can help, by talking to our patients. It's hard for us to do that, though. And where the Alliance members can maybe help talk to enough people, or write enough letters, or contact enough of the representatives and senators, that we can start to make them pay attention to the patients and the physicians instead of everything in favor of the insurance companies. Electronic medical records, we've been made into data processing clerks. The electronic medical records, they almost make you lie about things because you have to click something about a description on a patient or a way to give a medication. It's not what you want to do. It's not the correct one, but you can't go forward unless you click. There are so many problems with electronic medical records that were developed in order for us to be able to communicate between systems and find out patients' diagnoses or what tests they've had. And that's a miserable failure. We're not able to have interoperability between systems. And instead, it's just taking up more and more of our time to get everything done on computer. The metrics is one of my projects I wanted to work on. Many of you, if your spouse is involved with a hospital system, or if you're involved with a hospital system or even owners of practices where you have to meet a certain number of metrics, like you must see a certain number of patients per hour, or you must order a certain amount of tests per hour or per day or per week. You must order from certain places. We're not going to allow you to order from places that aren't part of our hospital system or things like that. There are so many metrics that have been set up that physicians are expected to comply with if they're working for that company or that corporation. And if they don't meet those metrics after 6 months or a year, they get their salaries cut or they lose their jobs. If they complain about it, my goodness, they're going to lose their jobs. It's not something we can really be out front about. And then the Medicaid payments, I'd already mentioned, that was one of my priorities, to get an increase in Medicaid payments. And the other thing I wanted to work on was spreading the word about organized medicine, that I truly think being a member of organized medicine helps prevent burnout. And burnout is not a term that physicians necessarily like. It's kind of like moral outrage. It's and talk about the burnout or moral outrage or things that are going on with COVID now, and how so many physicians' practices are suffering badly. Patients are afraid to come in, staff is afraid to work, they run out of PPE, which thank heavens the Texas Medical Association has really helped us with, and just various reasons. And then those physicians who are in the hospitals, the emergency physicians, anesthesiologists, critical care, hospitalists, radiologists, all those that are dealing with tons of COVID patients who are very sick and stay in the hospital sometimes for weeks at a time, and then still may die and put us at risk and our families at risk of catching COVID. They're still cutting, the hospitals are cutting the salaries. They're paying less with all this going on to the physicians because they're not making as much money because they're not having the elective surgeries and things like that. So it's just ridiculous what has happened. But by physicians being able to talk to other physicians about go to meetings, the Zoom's not as good as in-person meetings, but at least knowing people from being in organized medicine all along, being able to say, how are you handling such and such? How are you doing on this? Just being able to talk helps so much in this burnout. And if you know of physicians who possibly are in their own little silo, not involved in anything, of course, you probably don't know them if they're not involved in anything, but we are definitely seeing an increase in suicides and an increase in depression, more people having to close practices, just a mess that if they could just talk to other people and be in organized medicine, it would help them get through this so much. So that's clearly all my time. Thank you for anyone who stayed on and listened. I apologize if it's been so long. Well, it has been so long. And I just want to stress that being an emergency physician and being a physician itself, and therefore being president of the Texas Medical Association, was God's purpose for me. I know that, I believe that very strongly. And that's what keeps me going. There's no question about that. Thank you.
Well, thank you so much. What an amazing story. Thank you for sharing your life with us. We so appreciate you. You truly are an amazing person, like I said in the very beginning. And so thank you for being so open and honest with us. And yes, we are in it together for this fight, for this with the first Tuesdays coming up, I would encourage everybody to please make sure you register. The first Tuesday will be February 2nd is our very first one. And then while you're there, you might as well go ahead and register for March 2nd, April 6th, and May 4th. We have a lot of issues that are coming up. We don't know how much they're going to be able to accept or not, but it's important that we all stay together for this fight because it matters that we're all together. So thank you again, Dr. Fite, for your time and for your wonderful testimony. It is truly amazing. We really appreciate you very much. Thank you for fighting for medicine and for all that you've done in the world of medicine. And what an inspiration story. And I do hope you write a book. I know that I think it'd be an inspiration to young girls and to a lot of people out there. So please consider it because you are a special person. Again, I want to remind you, like I said, please sign up for First Tuesdays. Thank you again for attending today. We really appreciate all you. Next month is going to be the third Thursday of the month is our enrichment series, and it will be our Pam Udall, who is now the VP of Communications and Marketing for TMA. And she is going to be speaking on public speaking and that it's an art. So we look forward to that as well. I hope you can sign up for that. We are beginning our thing called Alliance in Motion, where we are going to be mentors to the residents and the resident spouses, as well as early careers and their spouses. We really need your stories on how you became Alliance members. So please send those into Sasha and to Pam so that we can publish those to encourage people to become Alliance members, because we play a very important role in the family medicine, and we need people to know who we are. I've always said we're the best kept secret in the whole nation, but really we need to be the most out there because we make a huge difference in our world. So thank you again today for your time, and thank you again, Dr. Fite. You're amazing. Everybody have a great day and a great rest of the month. We will talk to you later. Thank you, everybody.